Welcome back. Namibia's key transport corridors on high alert as the Walvis Bay Corridor Group steps up its Mpox prevention measures. Collaboration with the Ministry of Health and the World Health Organization, the group is rolling out intensified screening, infection control and awareness campaigns. Joining us to unpack these efforts is Mr. Kenneth Kamwi, Senior Project Coordinator at the Walvis Bay Corridor Group. Mr. Kamwi, good evening and welcome.
Good evening and thank you for having me.
Thank you so much for being here. Well, to start with, talk to us about what prompted the Corridor Group to heighten its Mpox preparedness, especially since I think the general public knows it's only been 2 cases that has been confirmed in the country, of course, within the Irongo region. Yeah.
Just to reiterate that the Minister of Health indeed has announced 2 cases that is in the Irongo region. Because of this report, it was important for the Walvis Bay Corridor Group as an important partner in the health sector to quickly activate the prevention and awareness services in terms of ensuring that the populations that we serve are protected, are ready, are well informed in terms of understanding what should they do, should we have more cases. And this is also important to ensure the readiness for us as the Walvis Bay Corridor Group, supporting the Minister of Health to ensure that should there be any cases that they are early detected, and they are also diagnosed, also ushered in terms of receiving treatment. So it is important, even if it's only 2 cases that have been reported so far, it is important for partners like the Walvis Bay Corridor Group to be ready to ensure that we deliver concise messages in terms of prevention, in terms of awareness, which are directed and guided by the Minister of Health. So this in general is what guided the Walvis Bay Corridor Group's preparedness and actions in terms of this outbreak as announced by the Minister of Health. Thank you.
Thank you. Well, as you've mentioned, the group felt it needed to quickly activate prevention and control measures. So just talk to us about the specific actions that is being taken, at the WBCG wellness centers, as well as the mobile clinics to protect both staff and corridor users.
Yeah. To start with, the Walvis Bay Corridor Group has a number of wellness centers that are across the corridors, that is in Southern Africa, in Namibia, Zambia, Angola, DRC. The very important thing that we are currently doing at all these centers, which includes the mobile health facilities, are one, which is screening. That is key in terms of our health personnel that engages with the community at large, which includes the truck drivers, the cross-border communities, and all the other communities that reside in and around the health facilities that we operate, that they are screened when they come in contact with them. The second one is also to ensure that should there be any case that is identified, there is a rapid referral between our facility and the Ministry of Health to ensure that these cases that are either for suspected of having Mpox are further assessed and also get treatment equal in terms of containing the outbreak. The other one is also to ensure that what we have done is to ensure that the hygiene around the facilities is maintained at higher standards in terms of ensuring that it's still and remains aligned to the Ministry of Health, which is key for staff and for the clients that come in contact with us at all the health facilities. The other one, key and very important, is training. Of course, the health personnel and all the other healthcare workers that work at the Corridor Group have been trained previously in terms of how to deal with Mpox. So the other key thing that we have done so far is to ensure that they are trained, they are reminded in terms of how to deal with Mpox. And this is done in line with the Ministry of Health guidelines as directed by the Ministry of Health.
Just elaborate a little bit further on what this training entails.
The training looks at the messaging in terms of, as you have just alluded to, that only 2 cases have been identified. The communities out there might be hearing this for the first time. So it looks at messaging in terms of how do we convey the message to the communities in terms of understanding what is Mpox without creating fear amongst the community members. So also to ensure that this training looks at the alignment between the Ministry of Health as the national leading institution entrusted by the government in terms of providing health services, that the screening is done according to the national guidelines and national surveillance systems that are in system. This also looks at the issues around joint initiatives between the Ministry of Health and the corridor group in terms of ensuring that there is that coordination and joint collaboration with the Ministry of Health and us as the corridor group. So the training looks at all these aspects to ensure the key messages that are delivered out there are standardized, that we speak one national language when it comes to Mpox, that the message is clear and it's the same one message, which then creates confidence in terms of the communities to understand and also seek services within the health facilities, which includes the one for the Walvis Bay Corridor Group.
Understood. Transport corridors are busy, high contact zones. So what are the biggest challenges, you would have in preventing cross-border transmission of Mpox amongst truck drivers and also mobile population?
The first one in itself is the fact that we deal with communities that are mobile may make it a bit challenging in terms of tracing and engaging them on a continuous level. Because, for example, a mobile population might be found in Oshikango today. 8 hours later, they might be at the coastal town. So in terms of dealing with this population, their mobility might present as a challenge. That's the first one. The other one looks at, which is not an issue now, should there be a difference in terms of the national protocols between member states? That as well might pose a challenge, but it is not one of the challenges that are there. The other is the issues around languages in terms of how the languages that we engage at on the day-to-day business in terms of us being at the entry points of the country. As you are aware, Namibia speaks English, but we have other member states like Angola, where the citizens from Angola do speak Portuguese. We have DRC. The citizens over there speak French. But in the areas where we deal, we have the mobile population that moves along all these corridors. So language can be one of the issues that might also be presented as a challenge for us in terms of engaging with the communities that we serve, in summary.
Just in conclusion, Mr. Kamwi, what message is it that you'd like to share with communities and drivers who make use of these corridors about staying alert and protecting themselves?
The key message is that Mpox outbreak is manageable. The Ministry of Health in Namibia has acted swiftly in terms of, one, they have announced in terms of what is happening. The ministry as well has continued in terms of providing information for the community, the public at large, through their social media platforms to understand and know what is Mpox, how do they react in terms of if they suspect, if they come in contact. So it's key that the public do look at all these socials in terms of understanding for them to be able to know what to do should they be involved in any of these cases. The other one is to say that as the Walvis Bay Corridor Group is a strategic partner, we are working towards supporting the Ministry of Health to ensure that we deliver the same message at community level. That's the first one. The other one is also to ensure that there is early detection and protection of the communities that we serve, that there shouldn't be any cases that may not be identified or the community being left behind. So that is key for all community members to understand that this is manageable. The ministry and the government has actually acted swiftly. And as the Walvis Bay Corridor Group, we have continued to support the Ministry of Health and will continue doing so. Thank you very much.
Excuse me, Mr. Kenneth Kamwi, thank you so much for your time. Thank you for joining us.
Thank you for having me.
We'll be right back after this brief break.